Good evening, everyone. Today we are going to talk about and discuss about intramedullary spinal cord tumors in this session of Conceptual Spine Connect. So what are we going to discuss in this? We are going to talk about the incidence, the genetic factors, the syrinx in these tumors. IMSCT is intramedullary spinal cord tumor. The pathogenesis, how do these tumors present clinically, imaging, treatment, and the complications. So, whenever we talk about spinal cord tumors, everyone generally is confused whenever we use the terms intradural, extradural, intramedullary, extramedullary. So, what exactly is the difference between these three different types of tumors? Now, broadly classifying, the tumor can be either extradural or intradural. If the tumor is intradural, it can be either intramedullary or extramedullary. Three images are shown over here. The tumor that is present outside the spinal cord, not present inside the dura or the spinal cord or the tube, which basically presses the spinal cord from outside. So that is basically the extradural tumor. It is one of the most commonest type of the three. And this particular tumor usually is metastatic. So I'm repeating, extradural is the one which is completely outside and it presses the spinal cord from the outside. In this process, it may cause some stretch on the nerves also. This is the most commonest type of tumors out of the three, and usually this one is metastatic. Now, the second type is the intradural, which can be further divided into either being intramedullary or extramedullary. So out of these two, intradural extramedullary is more common as compared to intradural intramedullary. So if we compare the incidence or the prevalence, so extramedullary is in 70 to 80% of the cases and intramedullary is only in 20 to 30% of the cases. Now, what is the difference between the two? Basically, these two tumors are the tumors which are present inside the spinal cord or inside the dura. As you see over here, this one and this one both are present inside. Now, the one that is inside, but it is not, engulfing the spinal cord. It is more of like a space occupying lesion, which is kind of causing the compression on the elements of the spinal cord inside. That is intradural extramedullary. Extramedullary is basically, it is not engulfing the spinal cord elements. And if ever it is present such that it is a part and parcel of the elements of the spinal cord being inside the spinal cord, that is intramedullary. So the tumor that is present as a space occupying lesion but inside the spinal cord, that is intradural extramedullary, and the one that is present inside the spinal cord engulfing the elements, that is intradural intramedullary. Now, I'm going to repeat in short. Extradural is the one in which the tumor is present outside the spinal cord and causes the compression from the outside. Intradural are the ones in which the tumor is present inside the spinal cord. If ever the tumor is present like a space occupying lesion and it is not engulfing the elements of the spinal cord, so that is intradural extramedullary. And the one that is present inside the spinal cord engulfing the elements of the spinal cord, that is intradural intramedullary, which is the rare out of the three. Now the prevalence is only 20 to 30% in intradural intramedullary type of tumors. And these are the tumors that we are going to discuss in this session. Now, what are the contents of dura? Why do you have to understand this? Because if you understand this, you will understand which tumors are basically going to be called intradural and intramedullary. So the different contents of dura are glial cells, vessels, that is hemangioblastomas, fat or lipoma. So, depending on the content, whenever there is a tumor, the tumor is given the terminology. So, there are three primary contents within the dura. One is the glial cells, the other is the vessels or blood vessels, and the third is the fat. So, whenever there is a tumor, that basically is a part of the glial cells, or basically it is forming from the glial cells. So, that will be gliomas. If ever it is originating from the blood vessels inside the dura, that is hemangioblastomas. The prevalence out of these would be 2 to 15% of the cases. And if the tumor is basically originating from the fat, it would be a lipoma. Gliomas make up to 80% of the intramedullary tumors. So out of these three, the ones that originate from the glial cells are the most commonest. Now, these gliomas may be subdivided further into two, astrocytomas and ependymomas, out of which astrocytomas are more common as compared to ependymomas. The difference we are going to talk about shortly. Astrocytomas more common in children and ependymomas more common in adults. So there are three main contents within the dura. One is the glial cells, the other is the vessels, and the third is the fat. Depending on the origin from where the tumor is originating, it may be either a glioma if ever the tumor is from the glial cells, hemangioblastoma if ever it is from the vessels, lipoma if from the fat. If we talk about gliomas, that can be further divided into two, astrocytomas and ependymomas, out of which astrocytomas are more common, and the prevalence of astrocytoma is more in children, and that of ependymomas is more in adults. Less common form of intramedullary tumors are metastatic tumors, which are only seen in 2% of the cases, and there may be other rare lesions that may be seen, but these are very rare and uncommon causes of intramedullary spinal cord tumors. Now, whenever we talk about these intramedullary spinal cord tumors, research has said that the prevalence of these tumors is higher than it is what originally thought. Why so? Because autopsy has revealed that 0.9 to 2.1% of the patients with cancers exhibit intramedullary spinal cord metastasis. Now, these tumors may not have caused any symptoms, but they are actually present. So, since they were not causing any symptoms, they have been missed. So, these tumors have been present, but since they are not causing any symptoms, or basically the other metastasis in the body may have caused more ruckus, because of which there might have been complications, because of which this particular tumor may have stayed there hidden. So incidence of these tumors hence might be higher than initially predicted. And for out of these intramedullary tumors with metastatic origin, 40 to 60%. Out of these intramedullary tumors with metastatic origin, 40 to 60% of them arise from the lung and 14% maybe from the breast. So, what we talk about is the most common sites of metastasis in regards to the intramedullary tumors with metastatic origin, and lung and the breast are the most commonest site. And the prevalence is higher than what originally thought, because autopsy has revealed that a lot of these patients do exhibit intramedullary spinal cord metastasis.